all got in. My popping got worse. My headaches got worse. My neck hurt. Had the earache. It was just bad. A friend of my daughter's had been coming to Dr. Jolly, and I had no idea who could treat TMJ. That's what my dentist told me I had. So she said, even if he can't help you, you'll enjoy talking to Dr. Jolly. He's so kind and so nice. Well, they are absolutely. I told him my second visit, I said, I have never seen such a wonderful group of young girls that are so friendly and so nice. And I told him that. They're precious. Every one of them. I have no more headaches. I have no more earaches. The back of my neck that hurts so badly doesn't hurt at all. And I've had a pain in behind my brow for years and years. And I was told that I had a cushion out of my vertebrae. For the last 4 weeks, I haven't had a single pain back there. And I'm shocked. I just can't believe that these retainers, he doesn't call them retainers, I've forgotten what he calls them, but I can't believe that they're helping this problem. And I was 86 when this all happened. And now I'm 87, and I never dreamed that anything like this could happen.
Dr. Jolly, we have to take a quick break. When we come back, I want to talk a little bit more about her case. But before we go, I want to ask you, do you get personal satisfaction out of helping these people?
Absolutely.
You're watching Medical News Network. I'm Mike Wittgenstein. We're in studio with Dr. Jolly, and we'll be right back.
Someone they don't know a gift. They do it because this gift saves lives. And the need for it is desperate. We need over 20,000 people to give this precious gift every day. Please give blood. There's a life to be saved right now. Call the American Red Cross at 1-800-GIVE-LIFE.
What is a hero? Are heroes born, or are they made? In after-school programs, your kids will uncover hidden strengths, discover they have the power to change their future, and find the hero inside themselves. Let us know you on after-school programs in your area. Call 1-800-USA-LEARN. After-school programs, helping kids find the hero within.
Welcome back. We're in studio with Dr. Jolly talking about TMJ and sleep disorders. All right, Doc, before we went to the break, we ran the clip of Kay, 86, 87 years old, obviously someone who was at a point in their life that thought they might be beyond help or not be helpable. What is a typical TMJ patient like?
Typically, TMJ can affect young people. We see as many young people as we do elderly. In her case, she had multiple symptoms, headaches, neck aches, that spot in her back that she referred to, and just had learned to live with the pain and just had kind of given up on life. Well, you can imagine if that's happening when you're 25 years old and people think you're crazy because you have headaches all day and you can't find a reason. You've been to neurosurgeons, you've been to ear, nose, and throat.
We've got another clip that I'm going to show next, and this lady said that they even sent her to, well, let's listen to what she had to say, and then we'll talk about it.
6 years ago, I developed terrible, constant, debilitating headaches. I went to numerous doctors, pain management doctors, neurologists, dentists, orthodontists, just continuous. And they finally even sent me to a psychiatrist to see if they could get something to relieve the pain. Nothing worked. Called Dr. Jolly's office and talked to his staff at length and knew that I could tell that they knew what they were talking about as far as TMJ was concerned. So I thought, well, I'll make an appointment, go in, and just see if I think he can do this job. Talked to him, And within 3 visits, we totally had the headaches under control. It was a miracle to me. But, well, my symptoms were not what you normally have with TMJ. My jaw didn't lock. I could get my mouth all the way open. I didn't have any pain in my jaw. My head just hurt. But I could press on my cheeks and up with these muscles around my face, and I could trigger a headache. I went to numerous doctors, and the solution was just to give me more medicine. The appliance was a little hard to get used to, but it was not painful. None. 0 pain. No pain. Within 48 hours after I put it in my mouth, my headaches were gone. And if I take it out of my mouth, in an hour, my head hurts again. So I just don't go without it, and it's become part of my life, and it's not a big deal at all. I don't even notice it anymore. Oh yes, I'm in a better mood. I'm much happier. They're wonderful. They are so nice and so down to earth and friendly. He is my hero. It's the best money I've ever spent in my life. I would do it in a heartbeat. I'd spend 3 times the amount of money. The beautiful thing is the appliance does not interfere with my daily life at all. It's wonderful.
All right, Dr. Jolly, I spoke to a ton of people when I was in. Unfortunately, we're not going to have time to see them all. But they all continued to repeat basically the same thing. She said she considered it a miracle, and they had actually sent her to a psychiatrist because they thought the pain was in her head. Is she a typical patient?
Well, there is really no typical patient. A patient, you can have TMD at any age. I wish I had a dime for every time a patient said to me, this is a miracle, because it doesn't make sense. You put a simple orthotic in the mouth and you get relief of all these different symptoms. She's been to a psychiatrist. We have women who come in and say, my husband thinks I'm crazy. I have these headaches and no one can find out why.
Does it normally affect just women?
No. Oh, absolutely not. We see as many men as we do. Well, actually, about 60% women, about 40% men, and don't ask me why,
Okay,
I don't know.
And I don't mean to cut you off, but we have to move along, and I want you make it sound simple with all you do is put a little orthotic. They all make it sound really simple, like all you have to do is put a little orthotic. It's really a lot more complex than that, is it not? Isn't there not special equipment that...
Right, yes. And let me make another point. You can't practice TMJ therapy if you don't have the right equipment. One of the things that says...
But you can practice TMJ therapy if you just happen to be a dentist. It's not
that's correct.
recognized specialty.
That's correct.
Any dentist can say they're
any dentist can treat TMJ.
But to treat it correctly...
You have to have the proper equipment. And if you'll show here, here's a CMT, where we take x-rays of the TMJ joint and the neck and the shoulders and all this. There's only 3 of these in Arkansas. We're one of the only 3 in Arkansas, and I have one of them. And then the joint...
So would it be, if I was looking for a doctor to treat TMJ, would it be good to find out if he had this machine
before? If he
before?
doesn't have that, he's, kind of guessing.
Kind of guessing.
Yeah. This is a joint vibration analysis, which is a sensor that we place right over the TMJ joint and have the patient go through ranges of motion, have them move the jaw, and it picks up and senses vibration in the joint, which is disc movement. And based on and this is a software, of course, and this tells me what type of, where you are in that stage of degeneration that we showed in the earlier clip. So if you have the right equipment, you can make a proper diagnosis. Diagnosis is everything. You must diagnose correctly to treat correctly.
But it seems that all these people have been to, and everybody I talked to in your office that day, have been to multiple doctors. They've been to all kinds of different neurologists, and they all seem to think they're at the end of their rope. And when they get to you, nobody believes that you can fix it that way. Do you hear that all the time?
I do hear that all the time. And of course, that's one of the frustrations I have as a practitioner in TMD, is that people don't know to come to the dentist. They have headaches. Where do you go? You go to a neurosurgeon.
Right.
You go to your general physician, or you go to ENT.
And most of them aren't well versed